All right, good morning, everyone. Thank you so much for being here. You know, it seems like every time we do this presser, it's sort of been gloom and doom. And I feel like this is probably the first presser where we are delivering some really positive news when it comes to the COVID risk meter. I think there's a lot to be thankful for. And actually, I'm happy to be sitting here and delivering some good news because sometimes we do need some. So I'm going to just dive right in. We're going to get right into the meat and potatoes of the COVID risk meter, and I'm going to send it to Dr. Jeremy Smith. Give us an update, please.
Thank you, Madam Mayor. Sure. And thanks, everyone, for being on the call. So I'm going to share the screen and take us through a few quick slides talking about the data as it is right now. All right. Can you guys see my screen? Just double checking. Good. Okay. So covidriskmeter.org. We know how to get there. This is what it looks like. For the past 2 weeks, each Monday, last week it was Tuesday because of the holiday, but the beginning of each week, we look at the past week and we set the risk meter based on the performance of the model. And so I'm happy to say for the past 2 weeks, we've moved out of the red very high and into this first tick of high of orange. So we're still in a situation where we have elevated risk of community spread, but we are not in that very high up against that purple boundary anymore. We're more between red and orange. And so conditions really have improved. I just want to quickly shout out that we've added a button to the homepage and to our resources page. So you can go and click this button and it'll take you to COVID-19washovaccine.com, where you can learn about how you can get signed up to get the vaccine. So that information is now linked there. Let's take a look at the data that's driving us down into the orange. So first off is risk assessments. These are when people want to get a test at the Washoe County Health District. They fill out a risk assessment online or they call. And the number of those daily is this black line. And we track this 14-day trend. And as you can see, it's been going down, down, down and continues to decline. So less people seem to be seeking testing, which would be a sign that, they're not feeling the symptoms and that the spread is being reduced. Likewise, test positivity, which is a measure of positive tests to total tests, has been going down. We reached a peak around 22% back in December. Now we're down to below 15% and moving our way to 12%, which would be the next threshold in our model, which would help bring our score down even more. Even better news on the new cases daily per 100,000 people. You can just see the shape of this curve. It's again, just like the risk assessments going down all the way down to about 30 right now, 28 to 30 as a 7-day average of new cases daily per 100,000 people. We're trying to get below 25 and lower to start reducing our model score. So we're really close. That's really encouraging. Our hospital conditions and the impact of COVID to our hospitals has improved greatly. And I'm sure some of the doctors on the call, or maybe Dr. Hass, will talk about it more. But you can see this thick blue line is the hospitalization curve. And it peaked right around Christmas. And that's been coming steadily down. Now we're down to today, about 175 people have COVID in the hospitals in the North region. Of that, about 35 or 37 are in the ICU. And you can just kind of look at these graphs at the right here. They're showing the top graph is the orange blob that you see up top here is over time, all of the hospitalization census in the North region. And the blue is the fraction that was COVID. And so you can see that peak right around Christmas, and it's been coming down. Same story for total ICU and COVID ICU. We've seen it come down tremendously. So really, really positive. This is our hospital capacity graph. And so I think you can see this little bump right here. That kind of put us into the red for a couple days last week, just 2 of the days, not enough to change the setting. But really, our ICU capacities are right at one threshold of 70%. So today they're just under 70%. And I think our overall hospital capacity, or occupancy rather, is just over 80%. So we're still looking really good in terms of hospital capacity right now. You can see quite a bit lower just generally than it was back in December. And so that translates into this historic model curve. You can see the last few days, we had a couple little bump where it just bumped into the red for 2 days, but for the most part, we've been scoring 9s and 8.5s. And so we hope to see that continue. And I think that the future does look pretty good in terms of our prediction. I'd like to turn it over to Aditya here, who can talk about the risk meter prediction.
Thanks, Jeremy. So I'm just going to follow up on what Jeremy was talking about and show you one graph that basically summarizes the prediction model as well as what's happening on the ground. So here, like I have this top graph, which basically shows you again zoomed in version of what happened in January. So it's the same graph that Jeremy was showing you, but now zoomed in just to the January scale. So you can see that we were in between this high and very high, and then we were steadily progressing on that. And then the blue is the true data that Jeremy showed you. There were like a couple of bumps on the road. And basically, this is what the predictive model's been doing in red. So you can see that we've been kind of predicting the trends really well in some sense over the past month. And now, at least for the future, for this week, the model tells us that if the things look, I mean, the trends look similar, then we are going to go towards, in between the high one and high two, still in the orange, but things are looking really great in terms of the prediction. So, and a couple of factors for that is just like Jeremy mentioned, at least the predictive model is saying that we are going to go below this 80 kind of hospital bed use. And what that'll do is, again, reduce like a 0.5, reduce the score or the risk score by 0.5. And also we are seeing like, the risk assessments are going down as well as the ICU, the COVID ICU bed use. So overall, the picture is looking great. It's still in the orange, but at least the trends are showing that we're going to go down. So back to you, Jeremy.
Thank you, Dr. Nair. That was fantastic. I think we're all pretty excited to see that the prediction is keeping us in that orange category. I believe it was all for 7.5s, which still keeps it in that same high orange tick mark. But as you saw, if we continue to go down with cases and test positivity, hopeful that we can get to the next orange tick mark and continue the descent. So with that, I'd like to turn it over to Councilwoman Dewar, who's
Yeah.
going to follow up with that.
Yeah, thank you so much, Jeremy and the team. And as everyone's heard, we're so pleased to be able to downgrade from this red to this orange. It's really meaningful, and it really tells us that we're seeing movement in the meter, and the meter is really working. Not only is the meter working to capture what's going on, but the prediction tool that we've come up with is actually tracking as per what Dr. Nair just showed. One thing we don't get into is deaths. So death is a lagging indicator, so we don't use it in the meter to say where are we going. But I will note for this meeting that deaths are down as well, very significantly. We spoke to Dr. Knight, the regional coroner, and she said that she sees that right in what's happening in her business. So they're on the downside. There is a real possibility with these new variants coming in, potentially them being more effective in terms of getting us sicker and potentially killing us, that we could go back into the red. And this is what we want to avoid. And I just want to do a huge shout out to why are we seeing these changes? I think we all agree that the changes are very much driven by our people. Our people are wearing masks. Our people are continuing to social distance. Our people are doing the right things, and their behavior is being reflected in the meter. And the meter, again, was designed to influence their behavior. So I think we have a good feedback loop on what's happening. We have information tool. It's working. People are paying attention. And again, I just wanted to reiterate, that's its purpose. Its purpose is not to open or shut things, control how the school board runs their business or how kids get taught. But again, it's not an enforcement tool. It's really meant as an educational tool. And from everything I see, I think it's working. So back to you, Mayor.
All right, thank you. All great points. And I've got to just say, I'm so impressed with the predictive model that Dr. Ron and Dr. Nair did. It is just, it's phenomenal, really. I always look forward to seeing how that's lining up with the COVID risk meter of the phenomenal job that Dr. Smith has done. It's really impressive. So thank you. All right, Dr. Hess, I'm going to send it over to you. I want you to give us a little idea what you're seeing in your practice and maybe talk a little bit about the variants, and then also like to talk a little bit about the vaccine. So go ahead, please.
Absolutely. Thank you, Madam Mayor. I just want to reiterate, I think there's a lot of positive trends that are occurring in our community. And I think it's a direct reflection of what people have done in their own lives. On some level, this has always been about personal behavior. And I think that that message got through. I really do. I think that the winter could have been significantly worse than it was. Not that it wasn't bad at times, but we've really improved things substantially, and it's a credit to our citizens. There are still obviously cases of COVID occurring. There are still hospitalizations. Unfortunately, there are still deaths, but we have improved it to a more manageable level. Keeping in mind for that one family, it doesn't matter that it's manageable. It's still devastating. So, it's still really important that we continue to try to follow all the current guidelines. I think the ultimate way out of this is vaccines. If you look at all the evidence, even with the new variants, the vaccines are looking quite effective. They may not be quite as effective with the new variants as they were to the old variants, but it's very, very unlikely they won't have some significant impact. And as I was telling some other folks earlier this week, I think that, worst case scenario, we go from a 95% protection to a 70% protection, which is still phenomenal, way better than what we get with a typical flu shot. So, and then the vaccines can be adjusted. Moderna, for instance, is already talking about maybe updating their vaccine for a third booster shot sometime maybe in the fall or next winter as a possibility, just to cover some of these newer variants. So our ability as a medical society to move these things, I think is really important. Just to briefly touch on the new variants, I think once again, they do appear to be more transmissible. They are definitely already here in the United States. We just had our first case of B117 in Clark County that was not identified from travel, which means that it was acquired through community spread. And it's very likely it's here in Washoe County as well. I think it's important to keep in mind with these new variants, the same tools apply. Social distancing, washing your hands, wearing a mask, and being consistent in those behaviors, and then getting vaccinated when you can. And I think that will really allow us to control it going forward.
Fantastic. All right, Dr. Ron, do you want to weigh in on some of that? Because I know you've been following the vaccines closely.
Well, I agree with John Hess. There are, to provide a few more details, the British variant, the UK variant B117 appears to be, up to 30% more transmissible, more virulent than the original. The vaccines work just fine against it. However, there doesn't seem to be any loss of effectiveness of the vaccine. The South African variant B1351 involves a mutation specific to the spike protein. And that's a reason why Moderna has reported that its vaccine is a little less effective against the South African variant because of the mutation to the spike protein. However, it will still work. But Moderna is, as Dr. Hess pointed out, Moderna is planning a booster shot. Also, the technology involved in these vaccines, we're talking about mRNA technologies, they're more amenable to reprogramming. You can fix the vaccine, you can change the vaccine much more rapidly than you can a vaccine that's made in the traditional way, such as the flu vaccine, which is made with a flu virus and with a killed flu virus, for example. There you have to start all the way from the beginning to change what your vaccine's doing, and that takes months. This is a reprogrammable vaccine, which is really exciting because you can change it with much less notice. I did want to talk about a little bit about pediatrics here a bit. I'm echoing the mayor's happiness at the good news, and I'm glad that we have a better situation today and fewer people dying and getting sick. But there is some other news, though, because we're not quite out of the woods. The American Academy of Pediatrics reported that as of last week, there were a record number of children who who came down with COVID, 211,000 cases in 1 week. Children are still about 12.6% of all cases in the United States. Greater than 10,000 have been hospitalized. It's about 1.8% of all COVID cases. About 0.6% of them die from it. However, 10 to 15% of cases have long-term consequences. Right now, the chronic COVID looks like mental fog, mental fog, fatigue, and temperature instability. And in addition, because the virus attacks heart and lung cells directly, we got a problem with myocarditis. Studies studies at Ohio State and at Vanderbilt show that children who and young athletes who get this virus can have inflammation of the heart. They can be at risk for sudden heart failure. They actually release troponin into the bloodstream. Troponin is a enzyme in heart cells that you find in the bloodstream after you've had a heart attack. So this indicates that direct damage to heart cells is occurring. And so it's important if a child or an adolescent is positive for COVID, even if they have no symptoms, even if they have only mild symptoms, it's important that parents take them to a pediatric cardiologist to be checked out. They can get an echocardiogram or perhaps an MRI that would see whether or not they had heart damage and what would the next treatment involve. That doesn't mean that they're guaranteed to get it, but when a certain percentage get it, you have to have this checked out at least for peace of mind, and so that's something that's very important. But in addition, you can have irregular heartbeat, you can have nausea, you can have chest pain. If any of those symptoms happen, get checked out by a cardiologist, and I would also recommend possibly a pulmonologist as well to check lung function.
Yeah, I think that's great points. And I'd like to ask Dr. Hess and Dr. Ariel, because everyone keeps talking about this as a respiratory illness, right? And then you're also saying be mindful that it's also vascular, right? So those in conjunction. So my question to you two would be, if you've had COVID, would you recommend that people go see their cardiologist, or
Yeah.
only possibly they have had symptoms that could possibly indicate that? Or if you have had COVID, would you say, down the line, you should go to your cardiologist and just have a simple checkup?
I would say go to a cardiologist. If you've had COVID, go to a cardiologist once, in the course of your treatment and get checked out. If all it does is gives you peace of mind because your heart's fine, the echocardiogram clears you, the MRI shows nothing wrong, celebrate it. It's wonderful. But if
Okay.
if the cardiologist visit shows, if the workup by the cardiologist shows that you've got some heart damage going on, then you need to change what you're doing every day. He or she's going to tell you to change your behavior, change your activities you're doing to protect yourself from further heart damage and protect yourself from a heart attack.
Okay.
Okay, so just for safety, this is important because the virus attacks those cells directly. The virus binds the receptor, the ACE2 receptor, that is involved in the function of heart and lung cells. So this is in addition to the damage caused by the overactive immune system as it responds to this. And by the way, these are not specific only to COVID. The SARS, the MERS infections from before showed evidence that they could cause heart damage. Coxsackie virus and Epstein-Barr virus, which are with us all the time, can cause heart damage, although it's relatively rare. So this should not be a surprising finding in a virus like this.
And
Mayor, I just wanted to add one more thing. I know the health district can be with us here today, and I know the story of the day is vaccines. So a couple things, if you don't mind. One, we want to encourage people to continue to check with the Washoe County Health District website, which is covid19washoevaccine.com. And you can sign up for email updates there, and you can find out what's going on with the vaccines. Second point I want to make is about the lanes. So we've switched from tiers to lanes. In the left lane, they're calling it now, are the essential workers or educators, your frontline workers. And in the right lane are your seniors, your over 70s. And so that is happening right now. The big challenge we're all facing is this lack of vaccine that people are hearing about. It's real. In Northern Nevada, Southern Nevada, we're getting lower numbers of vaccine per population. Our governor's written to the federal government saying, how come? You got to fix it. We should be on parity with everybody. So it's got to be addressed in order to get our community back into operation. So the number of first doses is declining, the ability to provide these vaccinations. I will say that your team, Mayor, is looking at ways that we can help with this vaccine rollout, whether it's coordination, whether it's letting people know where they are, or the back end is what we're hearing is getting the data into a database, because every vaccine that's issued has to have data associated with it. The state requires it, which makes sense, but entering the data does take time. And whether it's more volunteers or a more streamlined system, I know we're all as a group focused on that issue. So just wanted to speak. And then finally, Dr. Hess, Dr. Ariel, and Dr. Curry Winchell have been doing a series of town halls on the vaccines. I've had the privilege of seeing some of those town halls. They're a terrific amount of information. I don't know if they're up to about their 5th or 6th by now, but I know they're cranking them out. And it's a lot of good information about what the vaccine does, what it doesn't do, you know, how effective it is, and so on, how it interacts with the new variants. So I just wanted to put in a pitch for those town halls, and that, you know, we will hope to continue those.
Okay, thank you. Dr. Hess, I just want to go back to this. And the only reason I want to go back to this is because we still don't know all the layers of the after effects to this disease. So we were talking about how that could affect your heart. And I think it's important information that if you've had COVID, that this is something that you probably want to just get checked up. And again, later on, we don't know what some of those final effects could be because it's still so very new. Would you suggest you would go to see a cardiologist just like Dr. Ariel?
Well, you know, I'm a primary care doctor. I'm a family practitioner. And so I would say go to your primary care doctor first, have them do an assessment and evaluation, sort of look at your risk factors, symptomatology, certain, you know, cardiac tests like an echocardiogram, if warranted, can be ordered by your primary care doctor. And certainly referrals to cardiologists can be done as well, too. So, you know, I always kind of, you know, that's part of your job as a primary care physician is kind of be that, you know, kind of that broad view for patients. And so I always encourage patients to start there first. But the last thing you want to do is not get any kind of evaluation because, you know, unfortunately, well, it's not necessarily common. We are having patients with COVID. They seem to recover. And then a week, 2 weeks later, or even up to a month later, they'll develop significant symptoms, whether that's significant shortness of breath, chest discomfort, signs of heart failure, or even blood clots, you know, and that goes back to the vascular side of this. So I think it's very important. You know, I think people have kind of treated it like the flu in the sense, well, I got the flu, I'm just going to stay home, I'm going to take fluids and rest. And those are good things, don't get me wrong. But I think it's very important to have that communication with your primary care doctor to, you know, what's the next step? Do I need more evaluation? Do I need to get more testing done? So that's the approach that I would recommend.
Right. Okay. I think that that's fantastic. And the only reason I really wanted to stress that is so many people think it's respiratory, but there are other effects. And just to take that double precaution if you've had COVID. So the good news, the all around good news is the meter is going down thanks to Jeremy. That's really nice to see. I think Naomi touched on it. I think we have to commend our community for wearing masks, social distancing, and really paying attention because we also know we are not seeing that kind of outcome across the entire country. You're certainly seeing some pretty hefty challenges like in California and other parts of the country. So I think we have to praise our community for doing a fantastic job. And we're going to watch it closely because of these new variants. And obviously now the vaccine is here and that's positive news and will continue to trend, I believe, in the right direction. I think Naomi touched on it. We saw this week that we are receiving considerably less vaccines. The good news is I've also been on the phone with, through the Conference of Mayors, Biden's transition team. They are doing everything in their power to make sure that we set up some really large vaccination sites and just putting in some pretty good infrastructure, and they will get cities, what they've told us, they will get cities funding to be able to do this. So I want everyone to know the city of Reno will play a big part in that as well when we're ready to roll that out and we have the vaccines to be able to reach that capacity. I think that's going to be really important. So with that being said, I'm going to send it back to you, John, and to get everyone's day sort of wrapped up.
Good stuff. We'll open it up to questions here. We've got our usual round table of folks, and we'll start with Kristen from the RGJ.
Hi, so I just want to know if you're doing if local officials were doing anything to support local businesses. The CARES Act expired in December, so I know some people are struggling and they're frustrated with the extension of Governor Sisolak's statewide pause. So I was just wondering if there's anything being done locally.
Right. I think that's a great question. And absolutely, again, with the Biden's transition team, they said that they are going to allocate more funding for cities. So we will be able to identify those areas of where we can be the most effective. So we're looking forward to that. The city of Reno is still, we still have some of that CARES Act money. We were allowed the extension, which is really great. So those will be conversations that the council can weigh in and allocate in those areas where we see the greatest need. And obviously many of our small businesses are really struggling, especially our bars and our restaurants. So that's an area that we have identified. Councilwoman Dewar and I spoke this morning. We've also identified our artists. Many of them have been some of the hardest hit throughout the community. So there's a lot of different needs throughout, and the council will be able to allocate that money whenever it comes in.
Okay, thank you.
All right, fantastic. We'll move on to Channel 2 and Jason. Or Cynthia, if you're available, we can continue on. Let's go to Audrey with Colo. All right, quiet day today. Bob, go ahead.
Yeah, thank you. So I just want to be absolutely clear that the downturn in these numbers across the board, you're attributing that to social distancing, mask wearing, all the usual stuff we've been talking about for the last 10 months. Is that correct?
Yes, for me. I mean,
Dr. Hess, I'm going to let you weigh in.
Yeah, I think so. I mean, I think part of it is just the degree of compliance in that it's just taken a while for people to really buy in. I think some of it has just been messaging, but part of it also is, unfortunately, as things got really pretty bad there, sort of Thanksgiving, the first couple of weeks of December, at some point people begin to know somebody that didn't just get it, but actually got very ill or even died. And that really is the worst way to have to change behavior, but I think it did change behavior. So it's a combination of things. Probably the stay-at-home order, or I don't want to call this, but the governor's actions too, kind of at the end of November probably helped some as well. So I think it's a combination of things.
Thank you so much. And it's great to see these numbers going down. So I appreciate it. Thanks.
I think you make a great point, Dr. Hess, that people have what I've noticed is people have really started to see sort of personal stories and be connected, which is so unfortunate, but be connected to someone that they've loved and lost. And that is really, really sad. But I think people now finally realize they're not immune.
there are people that have said, once it hit one of their loved ones, they thought it was a hoax up to then, still today, still last week. It was a hoax, but now my child got super sick and almost died or did die. And they're telling everyone wear masks and social distance. I mean, I think you're so right, Dr. Hess. Personal experience hitting home.
All right, we've got Scott with AP.
Oh, I'm good. Thanks for doing this. Appreciate it.
Yeah, absolutely. All right, we'll give one last pass to 2 and 8 if you guys want to pop in.
Yeah, Mike is here with Colo.
Oh, great. Go ahead.
Yeah, I guess it'd probably be for Dr. Hess. I guess as these trends continue to go down, is there a clearer picture, or maybe it's always been clear, of where the number one source of transmission is, and is there something that we can still curtail as far as that?
That's a great question. transmission is still, the number one place to get COVID is at your home. And so, gatherings of individuals inside their own homes still is the number one area. Certainly any area where people are taking off their masks, they're congregating, you've got a large group of people in a relatively small area, indoors, is always going to be kind of considered a high risk activity. I do think as the numbers go down, as we get a larger portion of the population vaccinated, there will be some ability to kind of back off on some of those restrictions, because there'll just be a lower number of people that are carrying the virus. We're not there yet. There's still, it's still kind of crackling and burning under the surface. And, we don't want these new variants to take off. That's the kind of the concern right now.
We're seeing them, right, Dr. Hess? I mean, we now have them here.
Yeah, I know that in Michigan, they've had a fairly substantial number of the B117 cases. And I think in Minnesota, they identified the P1, which is out of Brazil. There's a new California variant. We're not quite sure how much more transmissible that variant is, although it may be a little bit. It's interesting. All these variants have kind of mutated in such a way that while they're different, they're similar mutations that are allowing it to kind of get around some of our behaviors and unfortunately past infection. The one thing I didn't mention, but the health department is doing some current studies, and they've got fairly good evidence of a substantial number of reinfections even here in Washoe County. As I mentioned, the good news is the vaccines seem to prevent that from occurring. But even if you've had COVID, you really should consider getting vaccinated when it's your time.
Good point.
All right, good stuff, guys. Any other final closing comments, Madam Mayor?
No, I think we're good. I just appreciate everyone helping us get the message out there, and whatever you do, stay safe and healthy. We'll see you soon.
I have one final thought is we're learning that people sign up for vaccine and then not show up, and it creates tremendous challenges for those that are distributing the vaccines. And so a final message for me would be if you have made multiple appointments and you took one, make sure you cancel the others so that they're not holding a place in line for you, because it means vaccine might go to waste. I mean, they're doing everything they can to get people that are like near the vaccine site vaccinated, but those things have no shelf life. Once those bottles are open, they have to be used. So it's incumbent on everyone to show up for their appointment or proactively cancel their appointment if they're under the weather, can't make it. You got to do that for our neighbors.
And I think that's a good point. I would just tell this to the media. What we're finding, I guess, is that people are sort of signing up on those waiting lists, different locations, and they're not canceling sort of those appointments. So even if you schedule one and you think you might get the vaccine faster over at another location, that people should be canceling those appointments that they have made. So if you could stress that, I think Councilman Dura is right, that we are seeing an issue and a problem with that. And we hope, we don't know, we're just saying we hope that we will have something in place through the COVID committee that we're working on that can help with that problem as well. So we'll keep everyone posted, but we want to be part of the solution and not the problem.
All right, good stuff. To media members or anybody else, just email me if you need a copy of this. We've got it obviously in the cloud, and I think we've also got a hard copy somewhere as well. So thanks so much, everybody, and we'll see you in 2 weeks.
All right, bye, everyone.
So have a good day.